offer what's called a manager's amendment, where he will come and essentially drop one amendment. It'll probably be, a 300-400-page amendment, because it'll be up to him individually to say, here's what these committees kind of meant to do, and we'll have one more, to translate it back into one version before you have one final vote on the House floor. That's why there's been some confusion about, hey, why is this bill going through 3 different committees at the same time? I mean, that's kind of unprecedented. I mean, it really should go, committee to committee, get changed, get have testimony, modified as you go. And it's easier to track and follow, especially for members and their staff to kind of keep track of where the changes are. So that's why I think there's so much confusion. That's why even the president, I think, in his speech the other night, he can't point to a single bill or because it's kind of changed over time. And that's why he's not sending up a specific piece of legislation himself, because it's kind of gone through that little more arcane process. And there are other alternatives that are out there. In fact, there are other alternatives that were introduced prior to this bill. I mean, they're a little bit smaller. I brought a couple tonight. They've been introduced in the House. Bipartisanly, one bill was offered in the Senate by Senator Wyden, for instance. And there's a few other bills in the House. And so, I mean, there are other alternatives that are out there. And I just think that we could probably get some really good results and address the cost side of the equation more than anything else, which would help the access side, if we could address some of the reforms I mentioned earlier, for instance. But that's why there's some confusion, I think, on what is really 3200 now. Over here.
Good evening, Congressman. Morris Moriarty here in Maple Grove for 30 years or so. I don't know where to begin on this, but I'll begin with this morning. I went and had my eyes examined. I came out of the thing, and there was a guy there with a translator. Translator. I want to know who's paying for that.
You are.
The time before that, I was in the very same place, and I was outed because the translator failed to show up. So they made me wait until another translator got called in.
What language were you speaking?
I was speaking English. And that's got to change. In any event, yeah, there's 86 languages here in the Twin Cities or in Minnesota, according to a guy that ran for the U.S. Senate. Now, I'm in the Republican Party. I used to be in the Democratic Party over in St. Paul. I see this very thing that's going on with AFAR over there. In fact, I was a part of it, I can tell you. I was in college. This thing has been turned inside out, and frankly, it has a lot to do with immigration. In this state, we pay, I don't know what it is, you were in the state, what do we pay, what's the add-on for all the hospital bills we pay for? For every medical thing, there's an add-on for every bill. I think it's 1.2%, 1.5%, something like that. Yeah. Yeah. Right. It's an add-on that nobody knows they're paying for. Well, I think there's overlap. When I was here, I was walking down the hall one time with Penny Steele. I asked Penny, I said, Penny, she's the ex-commissioner here. I said, is it true, Penny, that the emergency room in Hennepin County costs us $85 million a year? Now, this is a few years back. And Penny looked at me, and she's a very sincere, honest person. She says, I don't know. But she says the whole hospital costs us $450 million. Now, whether it's city, county, state, and federal, we are paying for a lot of medical stuff that shouldn't be there. Now, I want to get to a point. I was there when you got elected out of the precincts and the districts and so forth. Back. But I'll tell you something. I was watching TV here some time back, and I thought I was watching Paul Wellstone, because you were favoring these Albanians when the Indians were going to kick them out of the state. Now, I know we're carrying their medical care, their schooling care, their conversion care when you go to talk to a doctor, and a whole bunch of other stuff. We can't stand it anymore. We're knocked out.
There's a lot of folks who are talking about legal immigration and the concepts of that. There's some vague language in there. The president kind of addressed that the other night in his speech as well. I think the Senate is going to probably lead now the next reform bill. Has talked about specifically having some verification requirements, etc., which I think are very important. I mean, if you're going to actually do it, you got to have the verification side of the equation there. On the Liberian issue, you mentioned. I mean, the reason that I support the Liberian folks in particular is, they're here legally. status. You know, that was renewed under the previous administration too, and President Obama had renewed it. You know, and I worked on that. So, and I've heard people that, you know, hey, that's not right. But from my perspective, I think that was the right thing to do, and that's why I worked on that. So.
Yes, my name is Cindy Jackson, and I live in Plymouth. I work for a company that since last Christmas we've had 3 significant layoffs. Yet in that same time frame, I would watch our internal job board, and they would post at least 5 applications or applications for renewal for people on H-1B visas. So I saw a lot of Americans losing their jobs who were qualified to do the jobs that are currently still being done by people from overseas. And I'm wondering, why are we supporting Americans who are able, capable, and very willing to work, so they're on our unemployment rolls, some of them are losing their homes, they're definitely losing their health insurance when they lose their jobs. Is anybody addressing that? Why do we continue to renew and allow more H-1B visa people coming in for jobs such as accounting, purchasing, not anything that takes a very specialized degree that we couldn't find here?
Well, you know, the H-1B visas that you mentioned, I mean, that applies to sort of more that higher educated level, you know, worker that would have to be qualified to come in here. And, you know, there's a lottery system that's in place for folks to come here to participate. Now, that lottery system fills up essentially on the first day it's offered. That's my understanding. So, I mean, it closes immediately. And, you know, I know the economy's tough right now, but there's no probably other single issue Congress should be focusing on in terms of getting the economy going, other than deficit. Some of the immigration issues, you know, because there have been some pushes for more comprehensive immigration reform, you know, before I got to Congress, and I know it's been mentioned, it's coming forward. I mean, I'm going to tell you, it's not going to be taken up in the near future, just given, you know, kind of who controls Congress and the direction they want to go right now on health care and some of the other issues. So, you know, at the earliest level, I'm thinking it's probably going to be, you know, next year. I mean, it could come forward, and we can talk more about that, about the specific company examples, because I always look for the real anecdotes, you know, to talk about that, you know, how you can best help people. I'll give you one real quick anecdote that I have. Not on the other side, but it's just a similar story that is a little bit on the other side. But, you know, I talked to one individual, has an Eden Prairie company, who's looking for high-quality workers to do this new deployment of web software. And what ended up happening is he ran an ad in the Star Tribune and only came up with 2 qualified applicants. So, you know, he's got to launch his product for his company in Prairie. He's not going to survive. So he ends up running the exact same ad in the New Delhi paper in India. It has 800 qualified applicants. And so, I mean, that's just an example. That's a higher level in accounting, for instance, but it's an example of sort of, you know, he was trying to meet the workforce needs of his company. It ended up being a win-win because he got to open up an office over there and expand his operations here both, just from a win-win perspective. That might be a little more unique, but I'd like to hear your perspective too after. If you could grab me or a staff person actually, and we can talk more about it.
Hello, Congressman Paulsen, and I want to thank you for bringing us together tonight. I drove all the way from Washington County to hear what you have to say. I support single-payer health insurance, and I support that strongly. But I've made a compromise. I've made a compromise now to support the public option, and because difficult for me. I heard what you had to say about things that were important to you, about seeing them happen in whatever form we are able to have in our country. But I'd like to hear what you have to say about some real compromise towards meeting insurance, well, I'd like to say health needs of all of the people, and that there are coverage for everything they're sick with, and that it be cost effective. Can you tell me a little bit about that? Thank you so much.
Yeah, and you know, from my perspective, I think government should be a regulator.